Welcome back to Vet Image Lab. This lecture was created in response to a viewer request for a detailed explanation of Mass Effect on radiographs. This is part 1 of our Mass Effect series, and in this video we'll focus on the abdomen. You'll learn how to identify subtle organ displacement and localize the origin of a mass. Let's begin with a structured approach to reading abdominal radiographs. Mass effect in the abdomen refers to displacement of organs by space-occupying lesions like masses, effusion, or organ enlargement. In some cases, it may be the only clue to the presence or origin of a lesion, especially when the lesion itself isn't clearly visible. By observing how normal organs are shifted, you can also identify which organ is abnormally enlarged. To understand abdominal mass effect, we first need to know the normal positions of abdominal organs. Recognizing how organs are being pushed or shifted helps identify the presence, origin, and nature of a space-occupying lesion. These displacement patterns often provide critical clues, even when the lesion itself isn't clearly visible. When evaluating abdominal mass effect, before thinking about what the lesion might be, first determine which compartment it belongs to. This helps narrow down the possible origins. We divide the abdomen into 3 main compartments: the abdominal cavity, retroperitoneal space, and pelvic cavity. Then the abdominal cavity can be further divided into the cranial, middle, and caudal abdomen. Once you've localized the compartment, the next step is to figure out which organs are enlarged within that compartment. That's how you begin narrowing down the origin of the mass. Okay, let's talk about radiographic findings of each compartment and which organs are belong to each compartment. Let's start with the cranial abdomen. When a mass or an enlarged organ arises from this area, it usually pushes other organs caudally or dorsally. One of the easiest ways to detect this is by checking the position of the gas-filled stomach. Compare it with the normal stomach on the left. On the right, the stomach is clearly displaced caudally. That's your clue. A cranial abdominal mass effect is likely. The cranial abdomen includes the liver, gallbladder, stomach, spleen head, pancreas, and proximal duodenum. So when you see signs of a cranial mass effect, you can often narrow down the origin of the lesion to one of these organs. Let me show some examples. In this case of hepatomegaly, you can clearly see the gas-filled stomach shifted caudodorsally on the lateral view. And on the VD view, the stomach is also displaced caudally and to the left. This is another example. In a normal dog, the splenic head is located in the left cranial abdomen. In this case, the enlarged splenic head, marked with the dashed line, pushes the surrounding intestinal loops, shown by the arrows, caudally and to the left. Now let's look at mass effects in the middle abdomen. When a space-occupying lesion develops in the mid-abdomen, it pushes surrounding organs away from the center. Typically, cranial organs, like the liver or stomach, are displaced cranially, while caudal organs, such as the urinary bladder, are pushed caudally. The small intestine spreads out in all directions, what we call circumferential displacement. The colon tends to shift dorsally or laterally, depending on the lesion's location. The middle abdomen contains organs such as the spleen, parts of the pancreas, the jejunum, ileum, and mesenteric lymph nodes. So, when you identify a mass effect in this region, splenomegaly should be one of your top considerations. Also consider enlarged mesenteric or lumbar nodes, either reactive or metastatic. And remember, intestinal tumors like adenocarcinoma or lymphoma can also cause mass effect here. Let's move on to caudal abdominal mass effect. Masses in the caudal abdomen tend to push surrounding structures cranially and dorsally. One of the most important signs is dorsal displacement of the descending colon. Unlike middle abdominal masses, you will not see normal intestinal loops between the mass and the pelvic bone. That's because a caudal abdominal mass tends to push all the abdominal contents cranially. The caudal abdomen includes the bladder, prostate, and uterus. So when you see caudal mass effect suspect enlargement, or mass, from one of these organs, This case shows uterine enlargement due to pyometra. On the lateral view, a soft tissue mass occupies the ventral middle to caudal abdomen. At first glance, it may seem like a mid-abdominal mass, but here's the key. There are no normal intestinal loops between the mass and the pelvic bone. That tells you it's actually a caudal abdominal mass. On the VD view, you can see the enlarged uterus extending along both lateral sides of the abdomen. This bilateral tubular structure pushes the small intestines toward the central part of the abdominal cavity. This is a classic pattern of uterine enlargement, especially in cases like pyometra. This is another example. As you can see, there are two soft tissue density structures in the caudal abdomen. The cranial one is the urinary bladder, which appears normal. The caudal one is an enlarged prostate. Although the prostate is normally a pelvic organ, when it becomes enlarged, it can be displaced cranially into the caudal abdomen. This is a typical appearance of prostatic enlargement, such as benign prostatic hyperplasia on abdominal radiographs. This is another example of prostatic enlargement due to prostatic carcinoma. As you can see, the markedly enlarged prostate pushes the urinary bladder cranially. In addition, on the right image, it also displaces the small intestines cranially and the colon dorsally. Because there are no normal intestinal loops between the mass and the pelvic bone, we can confidently determine that the mass originates from the caudal abdomen. Let's move on to the pelvic mass effect. Due to the limited space within the bony pelvis, masses originating in the pelvic cavity cannot expand extensively. Instead, they tend to displace adjacent structures cranially, ventrally, or dorsally, and often cause narrowing of the rectum or urethra. Because of the overlap between the pelvic bones and soft tissue structures, the primary mass is often not directly visible on standard radiographs. However, if you perform contrast studies, you may observe ventral deviation or narrowing of the rectum, which can help identify a pelvic mass effect. This is an example of a pelvic mass effect. As you can see on the right image, there's a soft tissue density mass located within the pelvic cavity. This mass is pushing the rectum ventrally, which is clearly visible as a downward deviation from its normal dorsal location. The colon is also displaced cranially. This kind of rectal deviation is one of the few indirect signs that help us identify a pelvic mass, especially when the mass itself is not well visualized due to overlap with the pelvic bones. Here's another case. You can see the rectum is ventrally displaced, deviating from its expected dorsal position. This deviation suggests a space-occupying lesion within the pelvic cavity, most likely a mass compressing the rectum from above. When you observe this kind of pelvic mass effect, consider pathologic changes originating from the prostate, rectum, vagina, urethra, sacral lymph nodes, or surrounding soft tissues within the pelvic cavity. How can we differentiate a caudal abdominal mass from a pelvic mass? A caudal abdominal mass is located just cranial to the pelvic inlet. It typically pushes the colon dorsally, but does not affect the rectum. In contrast, a pelvic mass originates within the pelvic canal. It may also displace the colon dorsally, but more importantly, it often pushes the rectum ventrally or dorsally, a feature that's especially clear on contrast studies. Let's move on to the retroperitoneal space. The retroperitoneal space lacks a peritoneal lining and bordered by the vertebral column and sublumbar muscles dorsally and by the parietal peritoneum ventrally. It lies dorsal to the peritoneal cavity, extending from the diaphragm all the way to the pelvic inlet. This space contains important structures: the kidneys, ureters, adrenal glands, and major blood vessels like the aorta and caudal vena cava. It also includes regional lymph nodes, such as the aortic and lumbar lymph nodes, which are common sites for enlargement or metastasis. Let's take a look at the normal retroperitoneal space in a cat. This is a lateral radiograph, and as you can see, both kidneys are marked with asterisks. They're clearly visible and well outlined by perirenal fat, which appears as a slightly darker area in the retroperitoneal space. But in a Persian cat with polycystic kidney disease, the kidneys are markedly enlarged, as indicated by the asterisks. These enlarged kidneys are pushing the intestinal loops forward and downward. This is a typical example of a mass effect originating from the retroperitoneal space. It results in ventral and medial displacement of abdominal organs, especially the intestines. This displacement pattern is characteristic of retroperitoneal masses, such as renal tumors or adrenal gland enlargements. Let's take a closer look at the caudal retroperitoneal space. In this normal dog, you can see the retroperitoneal space is clearly visible, and the colon are in its normal position. This is an example showing mass effect in the caudal retroperitoneal space. In this case, the medial iliac lymph node is markedly enlarged, as labeled here, and causes ventral and medial displacement of the descending colon, which is traced here with the blue arrows. This is a key feature of medial iliac lymph nodes, which are located just cranial to the pelvic inlet and dorsal to the bladder within the retroperitoneal space. Let's summarize. When you suspect a mass in the abdomen, the first step is to identify which compartment is causing the mass effect. Once the compartment is localized, consider which organs are normally found in that region. This compartment-based approach helps you narrow down the origin of the mass and assess its likely characteristics, especially in cases where the mass is too large or poorly defined to visualize clearly. By following this method, you can make a more accurate and structured interpretation of complex abdominal radiographs. This is a summary table showing how different compartments affect the abdominal organs. Reviewing this can help you organize what you've learned so far. Take a moment to go through it, and if you have any questions, feel free to leave them in the comments below. Thanks for watching Vet Image Lab. If you found this lecture helpful, don't forget to like, subscribe, and turn on the notification bell. And don't miss our next lecture. We'll be covering thoracic mass effect in detail. See you there.